Typically, Botox is a very effective medication to take care of dynamic lines that come up when we move our face. Typically, Botox is used across ear, across the forehead lines, crow's feet, micro Botox across the cheek and the neck area. And it typically starts as a result in around 7-10 days and then stays for approximately around 3 months to 4 months. Typically, I tell my patients to use Botox at least around 3 times or maybe 4 times a year. And the more we use Botox over time, the lines that are very deep will slowly start disappearing because there is some element of preventive treatment that we can use. So before the wrinkle lines become very deep or even before they show up, Botox can be very effective in young people too to prevent new lines coming up. Here we have Tammy, and Tammy is interested in getting some work done on her face, and there's a few things that bother her very much. So Tammy, tell us, what is it about your face and your lines that bother you that you would like to get corrected today?
When I smile, the fine lines that I have right here, and also when I smile, these little lines that I have right here, and then I have several on my forehead. They're the fine lines that I want addressed today.
Can you look onto your left, Tammy, and show the lines and smile? So here we have the lines that come up when she smiles. These are what we call as a dynamic lines that come up when we use our muscles to work on the face. So those lines is typically where Botox can work very well. So typically Botox can be used. Tammy, could you turn your face this way? So frown for me now, Tammy. So you can have, she's got very little frown lines because she has used Botox before. Raise your eyebrows, and you can see some fine lines across there, and then smile for me. You can see a couple of lines coming up here. But more important, she has got lines that come up typically across here. And normally people don't use Botox in this area, but today what we're going to do is call as micro Botox, where we're going to take a very small amount of Botox, less than 0.01 cc of Botox, and put this just underneath the skin where there are muscle fibers that contract and create those vertical lines. In approximately 7-10 days, these will be diminished, may not completely disappear, but be significantly diminished, and she will see a chin area. We're also going to put some Botox across here, and then in this area so that she doesn't have crow's feet, no lines across there, and none across there. We can also put a small amount of Botox for her. Can you smile for me, Tammy, one more time? And you can see fine lines that come up over here again when that's what it is. And we can correct that, and Botox works very well for that too. So let's go ahead and get this process started. We're going to go ahead and mark her face and kind of draw a map for me so I know where to put the small amount of micro Botox. Thank you. So we're going to first and foremost wipe the face clean with alcohol. This is very important. And then having done that, we're going to mark the areas where we're going to give the Botox. Turn your head this way. And wipe. Go ahead and wipe off the alcohol this area too. This is typically where we would go ahead and inject to get rid of what they call as bunny lines, muscle fibers across here, corrugator muscle here, which makes you frown, and then a couple of times across here, a small amount in an eyebrow on each side to allow the eyebrows to be elevated. And smile for me again, and you can see she's got a little bit of lines across here, not too many, so you can take care of that too. And finally, we're going to ask her to smile really, and there we've got a couple of lines that we're going to take care with the micro Botox technique. The same thing on the other side, and then we'll start with the Botox injection. Also can be used quite effectively to take care of these muscle fibers that create what we call as number 11s on the neck. Tammy, can you make them more prominent? Tighten it up, and there they are across there. And these will disappear once I inject the Botox in 7 to 10 days. So we typically mark across 3 injections in the muscle fiber across here. And that will help a lot in making the neck much more smooth too. So here we're going to inject a small amount in the neck. Typically I will lift the muscle fiber up so that the Botox doesn't spread, and we inject a small quantity, 3 different locations on each side into what we call as a platysma band, and that finishes off her Botox treatment. Thank you. Typically for Botox, we'll use an extremely fine needle. That's a 32 gauge needle, the thinnest needle available in the world, so that it hurts the least. Tammy also has applied a little cream on her face for the last 20 minutes, and that will further minimize, if there is any pain whatsoever, she will have minimal discomfort from this. So this allows us to inject in the area between the brow, normally we inject 0.1 cc at this location. Can I have a 4x4 please? And we request patients not to go ahead and massage for at least 4 hours, not to lie down for 4 hours, so that the Botox does not spread from where we have injected it. A small amount, and then in the forehead. Typically that takes care of a muscle called frontalis, and that's typically a muscle that creates the horizontal lines on your forehead. As you can see, Tammy is handling this pretty well. We're going to start doing some Botox on the side of the crow's feet, outside the eyes. And do the same on the other side. And after this, we are going to go ahead and get started with the micro Botox treatment on the side of the cheek. And I'm going to demonstrate that. And typically we inject 0.1 cc for all these areas, but across here I'm going to put much less quantity, just underneath the skin, and small amount, and that'll help the muscle from contracting, and she will have less lines in a week to 10 days. All we need to do is to follow the grid pattern and keep on injecting along all those little locations, and that'll help those lines to disappear. We're going to do the same process on the other side. Thank you. We'll need some more. Where'd you go?